Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. We're going to learn about clinical management, practice management, and the emotional management of dentistry. Let's learn how to be happier in dentistry. Let's go. Thank you to our sponsors, Altum Dental Lab Group and RDT Dental Lab in Toronto. Hello, my friends. So grateful for you to join me again. Today, we have a very special podcast with my friend, Dr. Joel Rosenbloom, who's going to be talking about anxiety. So there are three things that I'd like you to get out of this podcast. One is to be able to identify when you are anxious. Two is to learn how to manage your anxiety. And three is to learn how to support other people who have anxiety. So, Joel, please introduce yourself.
Thank you very much for the invitation, Sanj. As you know, my name is Joel Rosenbloom. I'm an assistant professor teaching stream at the dental school. I'm director of student life at the dental school. I'm also a hospital dentist at CAMH, and I'm very involved in the intersection between mental health and dental health for many years, having worked in a mental health facility, but also starting a course at the dental school called Psychiatry and Dentistry. And the other flip side of that is I've been doing a lot of work in global health, stemming back to many years when I lived in Africa, and currently teaching in Ethiopia annually and involved in raising awareness and being a NOMA activist. Thank you very much.
Oh, you're welcome, Joel. Joel, you're selling yourself short. You are also one of everyone's favorite instructors at the University of Toronto. You've also helped advocate for NOMA, which is this horrible disease that starts in the mouth and it affects people's entire face, which is a horrible disease that occurs in Africa. You also moved to Africa right after you graduated and did dentistry there for several years. And you talked about that at the New Dentist Study Club meeting that you presented at a couple of years ago, and the group was enthralled. And I'd like to share how I first met Joel. I read an article that he wrote a few years ago. It was through the Canadian Association of Mental Health, CAMH, talking about, it was a series called 13 Reasons Why Not, like 13 Reasons Why Not to Kill Yourself. And I was so enthralled with what Joel wrote about his experience with mental health that I reached out to him, and that's how we became friends.
That's right.
So Joel, you're a special person. You do so many things for so many people, and you're doing a lot for us today because you did a talk a couple of weeks ago at the University of Toronto on anxiety, and it was a very well-received lecture, and we are very thankful that you're going to share some of that information with us. So Joel, how did you realize that you have anxiety?
It was a long journey. I think its roots were in dental school. And I know anybody who's gone through the process of dental school knows it's a tough road. And I struggled very deeply through dental school. It was tougher on me than other people. At the time, I didn't realize it. And we had an especially traumatic event in our third year. We had a suicide by a close friend of mine and our class president. And it really tipped me into a very deep spiral. Even through that, I managed to survive through a lot of maybe healthy and unhealthy coping strategies. And I got through it. And I was always of the impression that everybody kind of felt the same way. Everyone experienced the stress the same way. And only many years later, when I was in a very difficult job with a very difficult supervisor, did I spiral again deeply into this dark hole of anxiety. And it was only through that period that I was forced by my own account to seek external help. And that's when I was given the diagnosis of generalized anxiety disorder. And that's when I really truly realized that no, when I was in dental school, not everybody felt the way I did. Most people went through the stress of being a dental student, but coped with it, and it didn't almost take them down. So in those days, when I was in dental school, there wasn't a common language around mental illness. everyone knew about schizophrenia at a very superficial level. People maybe knew about depression at a superficial level, but it was really the realm of the psychiatrists, maybe the physicians to talk about. So the world has changed since then, and we all openly, commonly use terms like anxiety and bipolar and depression. And it's partly the internet, partly because it's just become much more normalized to accept and to discuss mental health problems. So I think my realization came without knowing it in dental school, but through another very serious phase in my life did it really get cemented that I'm not like everybody else. I've got this thing called anxiety, which is difficult to manage, although it is manageable, difficult to live with, although you can live with it, but it's just a part of who I am.
So, Joel, thank you so much for sharing that. Now, you mentioned it's difficult to manage, but it is manageable. How are you managing your anxiety?
So everybody does it differently, and there's many strategies. And I wouldn't say there's one thing that I might use to manage it. There's a lot of different things that I'll use. Things that are rooted in cognitive behavioral therapy, such as challenging negative thoughts. It's sort of an idea when a negative thought comes, you interrogate it, you challenge it, you look at it, you compare it historically. Has that horrible worst case scenario really ever happened? And it somehow slowly lessens the reality that it might happen. Another thing that I use and I try to use as much as possible is mindfulness. Mindfulness thinking to me is absolutely a great tool because it roots you in the present. People who suffer from anxiety are often, rehashing what happened in the past, and it just revs them up much more, or they're thinking about what's going to happen tomorrow and they're even becoming more anxious. When you're focused in the present, it makes you much more appreciative of the people and the places around you. Secondly, it kind of stops you from, spinning your wheels in the past or having sleepless nights about what's going to happen tomorrow. So mindfulness is to me a remarkable, remarkable tool. Another is yoga. I do yoga every single day for 30 minutes, and I lead some yoga classes at the school and yoga stretches. I would say I've done yoga for many, many years, 25 years or so, but really much more serious in the last 3 or 4 years. And I would say yoga has fundamentally changed who I am. I have this ability now to find a peaceful place when things are calm. Not always, but sometimes. And I can have a core of calm and zen that will allow me to kind of lessen the tension and the anxiety. There's many other things that I'll do. Perspective setting is a really important one. I mean, owning my anxiety. I know that it's not something that I'm ashamed of. It's part of who I am. It's my genetic makeup. It's something that I have to embrace for better or for worse, and just accept that it's there and then recognize when it's coming on so I can do things. So it's a whole, there's other things too, but it's like a little bit of all of these things that allows therapy is another one that I was in therapy for many, many years. I'm not now, not because I don't want to be, because I just haven't found the right person again. But
Hmm.
therapy has been an enormously helpful thing for me. And I truly recommend it for not just people with anxiety, but everybody, I think, benefits from therapy. Um, if you find the right therapist, finding the right therapist to me is the key that unlocks the door to help you kind of pick things apart and understand them better.
Oh, thanks, Joel. A lot of things you mentioned just don't help with general anxiety disorder, but just getting through the little stresses of everyday life. Like I do yoga, I do mindfulness, I meditate, and I also like challenge my negative behaviors as well. Like whenever a negative thought comes in, when I say something like, "Oh, you're a crappy dentist," I'm like, "Wait a second, that was a negative thought, put it into a positive." And also like I went through therapy as well. I had a challenging time with my family earlier this year, and the therapist said, okay, every time you think something bad's going to happen, like your family's going to fall apart, pretend that you're in a court and you have to prove that to the judge. And he's like, okay, now Sanj, prove it. Prove it that your family's going to fall apart. And I'm like, actually, I can't. And then he's like, see, so it's not going to. And
Right.
yeah, the with the yoga, people are like, I don't understand what this yoga thing's about. It's like, well, you have to focus on your breathing, which is a very helpful technique to challenge everyday stresses, but also with our patients. Like I see a lot of children and I get them to breathe. We inhale and exhale together. So it helps decrease stress at the moment. And with yoga also, if you're not focused on the moves, you're going to fall over. So
Yeah.
yoga helps with the mindfulness. And mindfulness means go for a walk and look at the leaves. Look at the birds, look at the trees, and then all of a sudden you're not thinking about the future like you said, or thinking to the past, which is ruminating. So yeah, a lot of good tips you mentioned. But you mentioned
No,
something that I'm
absolutely.
perspective.
They work for everybody.
I
Yeah.
know everyone should be doing it. Now you
Yeah.
mentioned something called perspective setting. What is that?
Perspective setting.
Yeah,
Well,
what is
I mean,
that?
I can give you a really good example, and it's not feeding off other people's misery at all. It's putting into perspective your own perceived problems. When I was in Ethiopia with my two students, we spent one day in the OR with, I know a lot of the OMFS people from my years of going, and it helps us understand what they deal with. And we met one 32-year-old Ethiopian woman who was being prepped for the OR, sitting in the hallway. The surgeon showed us what she was going through, and she had a squamous cell carcinoma that was the entire like suborbital region right out to here. It was quite large, and I knew what they were going to do. They were going to have to do a hemimaxilloectomy, and to do that, they were going to have to basically put an incision right across her face and peel back her entire
Oh,
skin to take it out and then remove the maxilla. So we looked at it, and this poor, terrified woman was just sitting there and knowing what she would have to go through. After after we left and she was taken into the OR, I turned to one of the students and I said, I don't have any problems. My problems are
wow.
insignificant. When I look at the horror that this woman has to face, and I think, wow, put it in perspective. Like, yeah, I've got problems, but this is a real
Yeah,
problem. So,
yeah.
you can find that in different ways. And it's not about looking for people who are worse off than you at all.
Hmm.
It's just somehow putting your own perceived problems in the context of the greater whole. You just have to read the
Yes.
paper and look what's happened in
Hmm.
Valencia, Spain. Look what's going on in Sudan.
Hmm.
Look at what so many people are struggling to go through. And I mean, okay, wait a second. I have a job,
Yeah.
house. I have a job I love. I have, good friends, good family, great students. I mean, okay, yes, I do have my struggles, but there's a lot of really good things. It's kind of more of a glass half full than a glass half empty kind of looking at things.
Mm.
So
Yeah, that's great. And Joel, do you meditate?
outside of yoga, not so much. In yoga, I do. Sometimes I do. I go through fits and spurts of doing meditation, but I love it. I think it's great. But I guess I'm lazy, and I think when I do my yoga, I'm meditating. So I would certainly think of doing it more often, but there's only so much you can do in a day.
Yeah. I start every morning with 10 minutes of meditating. It took me years to figure out how to meditate, to clear your mind and just
Yeah.
focus on your breath. But whenever I go through stressful situation, I just focus on breathing. And then it gets me out of that sympathetic nervous system fight
Yeah.
or flight moment to my parasympathetic, where now I'm calm and I can think logically.
Yeah. No, so that being said, even if I don't meditate, I do really use deep breathing a lot.
Yeah.
If I'm
Yeah.
sort of in a situation or something's going on, I stop, I think, breathe, just breathe. And I use that with students a lot too. When they're going through some
Yeah.
practical exams, I'll always tell my group, you're feeling stressed, just take a few deep breaths. You'll just feel better automatically because all of that good, rich oxygen blood will go
Yeah.
to different parts of your body.
Oh, good. Now, how about how should we support someone who has anxiety?
I'm certainly no expert, but I think that in this talk that I gave, the main reason
Yes.
I wanted to give this talk, and one of my like really close students who I've worked with a lot on Noma, and she was in Ethiopia. She really pushed me as well to do it. And I think the main reason why I wanted to do it, it was a bit of a scary talk because I talked about a lot of things from,
Mm,
suicide to drug use to like personal drug use to cope to
hmm
like a lot of things that most people in my position would never talk about publicly.
mm,
And I think the greatest incentive for me in doing this was that if I do it, then students who know me as a professor here will think, whoa, this guy's like a professor, and he's won a lot of awards. He's like really
hmm
highly looked upon, blah blah blah. He can come forward and talk about this vulnerable side of himself. Well, surely I can do it. And the one comment that came up most frequently at the end of it is that students all came up to me and said to me and to themselves that they're not comfortable. They didn't think it was okay to talk to each other about it.
hmm
And that was the overarching purpose for me to do this. If I can do this, then hopefully students will feel more comfortable going up to a close friend and saying, "Hey, like going through something here. Can we just go somewhere quiet and talk?" So to me, that was one of the greatest outcomes of it.
Oh, that's wonderful, Joel. Do you want to share some more things about what you said during your talk?
Well, I talked about a lot of personal stories. I
Mm,
mean, I went into a little more detail about, for example, my classmate who died by suicide. And it was heavy.
mm,
It was very heavy to talk about, and how the impact of it on the class, but in particular on me. I also talked about how I coped. And at that time, part of my coping was this fear of failure. And as much as
mm,
I had this perpetual desire to drop out of dental school, I kept hanging on for various reasons. But after this particular event, I started using a lot of smoking a lot of pot. And I talked about that, which I wasn't sure I would, but I did.
mm,
And some of the other things I talked about was when I had this very difficult job with this very difficult supervisor, how it really pushed me into such a dark spiral that some of the things that I did, which were, I think back on it, it was incredibly, incredibly like off the charts, is I started pushing myself and cycling with my eyes closed on Queen Street because I cycle on Queen Street and pushing myself to cycle just a little bit longer. And I don't know if most people have never cycled with their eyes closed. I cycle everywhere all the time, but I mean, it's just the most ludicrous thing in the world to do. And that's when I started realizing, and like a switch came on. I started realizing I need help. I need someone who I can seek professional advice from. And that's where I found a therapist who I stayed with for 10 years. And that's when eventually I quit this job and said, enough is enough. But the epiphany wasn't so much that I had to quit the job. The epiphany was that I had a young child who was 4 or 5, and I could see the look in his face every day when I came home. And he just knew that I hated my job. I was a miserable, unhappy human being. And it was, to me, the greatest realization was, wait a second. I mean, anyone who's a parent, which I know you are,
hmm
it's not about you all the time. It's often about your kid or your children. And that's when I realized, whoa, I do not, I can't live with having my child grow up knowing his father hates his job. That can't be a baseline thing for him to go through life. I can't do that anymore. So I thought I have to quit. I have to find some way to show him that, work isn't something you hate and you look forward to the end of so you can retire. Work is
mm,
something that you gain a love and appreciation, and you find all the great things about it. And fortunately, I did find my way back to a job both at the University of CAMH that I'm deeply in love with, and every day is a joy, a treat. And he saw that, and I made a point of bringing him to a lot of university events. He came to the CAMH clinic because his school was across the street. He
mm,
saw how much my patients respected me when we walked through the grounds of CAMH, and the most rough looking people with mental illness would come over to me and say, "Is that your son?" And I say, "Yeah." And they'd look at my son and they'd say, "Your father's like a really great man, a really great dentist." So I feel proud of myself that I could turn this around,
yeah.
see that he's got a father who's well respected at a hospital and well respected at a university. On top of that, loves his job. So that was kind of the biggest epiphany, is I have to do something better so my child will see that work is something that you can really gain enormous pride, joy, privilege, and like a really happy life out of.
You're such a role model, not just for your son, but for all of us. It's hard to believe that you hated your career because when I see you, you're just like exuding joy from being a dentist, from working at CAMH, from being an instructor at University of Toronto. So yeah, I was really touched by what you said. And you mentioned that you were riding your bike with your eyes closed. Was that because you were hoping you would die?
Well, I mean, you know, anybody who's been in a dark spiral has suicidal thoughts.
Hmm.
And I wouldn't say I was hoping I would die, but I had such little value attached to where I was in life that it didn't seem to matter. I think the only thing that really held me forward was, more than anything, my son. Um, and I know at CAMH, because I've read hundreds, maybe thousands of psychiatrist notes for all my patients, there's two questions they always ask when someone
Hmm.
exhibits suicidal behavior. Do you have suicidal ideation?
Hmm.
And it's either yes or no. And if yes, the next question is, do you have a plan? And if
Hmm.
someone has a plan, then they get what's called formed. I don't know if you know what forming means.
No.
Forming means that they issue a form, and the form gives the police, if they need to bring the police in, the right to apprehend them as similar to an arrest,
Hmm.
and take them to a hospital with a psychiatric unit, and they're held against their will for 72 hours till they get a psychiatric diagnosis. So
Wow.
having a plan is that's the thing that determines
Hmm.
if this is more serious than flirting with suicidal thoughts. So why did I do it? Was I hoping I would die? I don't think I was, but I certainly felt and flirted with suicidal thoughts throughout this very dark period. So um, that's so it wasn't so much hoping, it was more the value that I had on my life was quite low at that time.
What's your advice to people who have suicidal ideation?
Advice: if you feel that way, go to CAMH Emerge.
Okay.
That's the best place to go in the city, in Toronto, or any hospital. Every hospital has a psychiatric department, every major downtown hospital. But go to CAMH Emerge, or go to a downtown hospital with a psych unit, and get someone to assess you.
You know what's interesting when you talked about the story with your son? Because when my son was the same age, 4, he realized that I was miserable in my job and I made a big turn in my career as well. So we're both thankful to our sons for realizing that we're unhappy and inspiring us to make the change. Now
Yeah,
you,
thank God for kids.
yeah, it's true. And you mentioned you have general anxiety disorder. Not everyone has general anxiety, but we all have a little bit of anxiety. So what's the difference between having that little bit of anxiety, like, oh my gosh, I have to take that tooth out or do that root canal, find that MB2, compared to general anxiety?
Well, generalized anxiety disorder it's a form of anxiety. There's a lot of
Okay.
different forms of anxiety. Anxiety can be fears and phobias. It can be generalized anxiety disorder. It can be panic. So it can be like a number of different things. Generalized anxiety disorder is the most common form of anxiety. So what's the difference? I mean, most people carry on in their lives and they cope quite well, but someone with anxiety, you lose things such as your natural resilience. The
Mm.
smallest things can set you off in a way that most people would just deal with, because you lose a certain degree of your core resilience and confidence. Other things that happen is you are prone to catastrophic thinking. Like the smallest
Okay.
thing, it's, oh my God, I didn't renew my license. I'm going to lose my
Oh,
license. I'm not going to work. And as yet things spiral, and it's what I call 0 to 60 miles per hour thinking. You just
mm.
shoot across, and all of a sudden things are spinning out of control so fast that it's hard to peel it back. So these are kind of you're prone to phobias. That's
Mm.
as a form of anxiety. I think the biggest difference between someone who has, we all have anxiety. Every single
Hmm.
person has anxiety. But for someone with diagnosable anxiety, there's more triggers, there's different triggers, there's unpredictable triggers, and there's a lot less ability to cope when things come at you.
Mm.
So we all have it, but someone like me, it's there all the time. And I'm always, it's when I say own your anxiety, I always know I've
Mm.
got this frenemy sitting on my shoulder that I've got to be aware of. And I've got to always feed it and, nurture it and be good to it. But it's always there. Most people with anxiety comes. I got a big test tomorrow. Of course, it's
Yes.
natural to be
Yes.
anxious. I'm doing a crown tomorrow. If I don't do a lot of
Yes.
crowns, I'm anxious. But
Yes.
you're not anxious about the little things in life.
So do you wake up anxious?
Um, I think right now I'm in a reasonably okay place. I would
Hmm.
say my anxiety is probably a little more under control than at other points in my life. Sometimes I do, sometimes I don't, but I usually do yoga like as soon as I wake up, I have coffee and do yoga every day.
Mm.
So that helps set me on a bit more of a path. So I'm not quite so, I'm not spiraling. I'm starting out in a grounded way.
Okay. Have you ever had a panic attack?
Yes.
Okay, so describe that and how to manage that.
Well, panic attacks are pretty intense. Have you had a panic attack?
No, I haven't.
I mean, they're full on body sensations. Your heart races. You completely
Okay.
lose your appetite. You can't sit still. You can't focus on anything. Your minds just keep getting, it's like a snowball rolling down the hill. The thoughts get bigger and uglier and messier and worse until either you just can't control it. And
Wow.
you're in one room, that's not good enough. You get up, you have to go to the next room. You can't sit there, you go to the next room. You just can't sit still. You can't cope with anything. So either one of two things happen. You really do end up in the hospital because some people will say panic attack can feel like heart attacks because your
Mm.
heart is racing so much, pounding, and your body is just reacting in such a sink or swim you know mechanism. Or the other thing, in the case when it happened to me, I just got exhausted. It just
Mm.
wore me out, and it was like going for a run. At the end of it, I was just like, I had
Wow.
considered, that's one of the only times I actually came this close to taking myself to the CAMH emerge, because it
Wow.
was really spinning and spiraling so bad. I don't quite know what caused it to end, but I think it was more just complete exhaustion.
Yes. If we see someone going through a panic attack, what should we do? Like, for example, sometimes our patients will start hyperventilating before we give them the needle. Is that similar to a panic attack?
I don't think so. I mean, I think
Okay.
that's probably really something that is triggered by one specific thing,
Okay.
like a needle.
Hmm.
So, you can manage that, I guess, by asking them to deep breathe, by
Hmm.
talking them through it, by, just being that really great dentist who really cares. And most people, you'll manage them through it. But I'm not
Hmm.
sure, like a panic attack, you may not see it. Someone might call you and they might say, I just can't stop thinking about this, and it's like worse and worse. There's scattered thoughts
Mm.
there. I think the thing to do is if you can talk them through it, great. If not, just tell them to go to the hospital,
Okay. Great.
because panic can be pretty brutal.
So it's amazing that you're able to share your story to help others share theirs, that you're able to manage your anxiety, that you've eh, changed careers and now you love what you do. Now you mentioned therapy. How can the audience find a therapist? How did you find yours? What advice do you have for people to seek help?
But the most important advice I would say is not all therapists are good fits.
Hmm.
The most important thing in my experience of having had numerous therapists, it has to be a good fit. You have to like this person. You have to want to talk to this person. You have to like develop that type of professional relationship with them. And um, there's no sense continuing therapy if it's not a good fit. The therapist I had for 10 years, it was a great fit. She was, she was hip, she was young. We had a lot of common interests. We both loved classical music and opera. So we'd start by just chit-chatting about did you see the opera? Did you go and we had a common base of love for these things that we would talk about. And I just felt like she was like a good friend of mine who happened to be a therapist that I could talk to. And to me, that was the most important thing is she gave me her undivided attention. She was kind. She was able to redirect me. She was able to put prompts to get me to think in a different way. And she just knew me
Mm,
well enough to help me through things. I've had other therapists who they were nice people, but we didn't gel. I don't think I've ever had another therapist like this person. She moved away. It
mhm,
wasn't like we
mhm,
quit or she fired me. She moved to another city. So our professional relationship had to end. But I think that's the most important thing to find. How do you find a good therapist? It's not easy. It's very difficult. It's very expensive because there's very
mhm,
few OHIP covered therapists. The only ones are physicians. And any physician who does therapy and it's paid through OHIP, they're usually so busy because there's such a demand for physicians who do therapy because there's so few and it's so expensive otherwise.
mhm.
So the only way I've ever found therapists, I have a lot of friends who are both physicians and physician therapists. And so they've usually connected me to people. And I hate to say it, they've used their connections to get me in when I wouldn't have otherwise gotten in. So I think the best place to try and find a therapist is through your family doctor
Oh, great.
or someone who you may know who is in the therapy world. I don't think there's one great website to go to for therapists. I think you really have to word of mouth. And I would strongly urge if after a few appointments you don't feel like you got some kind of connection,
Mhm,
you know, cut the relationship loose and look again because it's never going to come if you don't have it. It's my experience in therapy. If you want to open up and share with someone, you have to feel confident and trustful that
mm.
they're there with their undivided attention and you're comfortable sharing some scary things that you won't share with anyone else.
Now, for students, they can also go to their school therapist.
Yeah, we have a
There's,
therapist at the dental school.
oh, that's
Yeah,
awesome.
she's a dedicated therapist at the school.
Oh, excellent.
So they
And
can go to
then,
her or they can go to student health services, and student health
okay.
services has a resident psychiatrist.
Oh, great.
And I think they might have therapy. So if they came to me, I'd say this is the number of the person because that's part of my job to oversee wellness. This is the
Yeah.
number of the person. You can call this therapist, or I would say consequently go to student health and you can see the psychiatrist there. Now they wouldn't take you on for long-term therapy, but they would help
Mhm.
connect you excuse me, to someone who would.
Yes, and for dentists, they can use a dentist in Ontario can use the Ontario Dental Association's member assistance program.
Right,
So, and then
right,
their staff and family get therapy as well. So you get
right. I didn't know
free
that. Yeah.
free phone therapy. You get 3 or 4
Uh,
sessions. And then after
that's
that,
great.
they will refer you to someone else.
Right,
Also, my friend told me that the website Psychology Today, you can find a therapist and even a therapist in your language. So
right. Wow.
Psychology Today is another one.
The only
Yeah,
problem with those is you have to pay for them,
yeah, that's right.
and it can
Psychology
be
Today,
quite
you have to
expensive.
pay.
It can be
I
quite
agree.
expensive, like $150 a session. So that's a
Hmm.
little bit a lot for people who aren't in a fairly good job. But
Yes,
I guess you have to decide how important it is for you.
it's true. And my friends who have paid for therapy said it was the best money they've ever spent. They said,
Yeah,
hey, people
yeah,
spend just as much getting a personal trainer to
yeah. Or
train their
getting
physical body. This is for
yeah.
their mental health,
No,
which
I
is
I,
even more
I
important.
totally agree. Yeah,
Yes, but there are free services out there, the employee assistance
yeah,
program, member assistance program, so
yeah.
that's helpful too.
Great.
So is there
Yeah.
anything else you'd like to share, Joel?
Um, I think that in this day, the only other thing I'd like to share is I think in this day and age where so much of us are on our cell phones all the time, I
Mhm.
feel like we very take the time to have genuine human connections. You know, not this, yeah, like just give me a minute. And I think that if we were all just a little bit more aware of how the people around us are doing, our close friends, not the whole community, like in dental school, for example, and you saw someone was out of sorts, I think to reach out to that person and say, hey, I've noticed you're not quite yourself. And, you know, like, let's talk. I think the Bell, program of Let's Talk
Yeah.
it really rings a bell for me, because if you can find a good friend who's willing to listen, really genuinely, truly listen and show concern and show that they really care about you, and they're worried about you and they're available for you, that's going to go a long, long way. And if everyone would have that mindset, not just to listen, but to talk, to reach out,
Yeah.
or to be ready if someone reaches out to you. I think that's understated, and we're all so busy that we just channel a lot. We just bury a lot of this just to get through the day. And I will be okay. I'm a strong person. I can bury it, but I think eventually it finds its way out.
Yeah. That's such good advice that we should make one-on-one human connections, that we should talk to people who we see that are upset. And even if they don't feel comfortable talking, just putting your arm around them, holding their hand, just sitting beside them, they realize that they're worth it.
Yeah,
That they know that things are going to get better the next day, that someone cares,
yeah, it helps a lot.
that they have value.
Yeah,
Yeah.
yeah,
Well, thank you very much, Joel. How
no
can the
problem.
audience get in touch with you?
U of T.
Good. So
Email
what?
the best place to get me is at U of T. Email me. I'm on
Oh,
the faculty website. So
oh, great.
if you go to U of T website and look up faculty directory, my
Yes.
email's on the faculty directory.
And what's your email?
Is my first dot last name at
Okay,
utoronto.ca.
good. Joel.rosenbloom at
Toronto.ca. Or if you
utoronto.ca.
don't remember, just go to the faculty website
Mhm.
and faculty directory.
Well, of
Great.
course, everyone's going to remember. This was such an
Well, thank you.
insightful podcast. Thank you so much for sharing,
My
Joel, and thanks for
pleasure.
being
Yeah,
such a good friend as well.
no
And thanks
problem.
to the audience for listening.
Thanks for having me. I appreciate
You're,
it.
you're welcome. Bye, Joel. Bye,
Have a nice
everyone.
evening. Bye.
This podcast is sponsored by RDT Dental Laboratory, your full-service dental lab in Toronto. RDT Dental Lab will help you grow your practice through education, predictable restorations, and high attention to your clinical needs and patient experience. Check them out at rdtdentallab.com. Thank you for listening to the New Dentist Study Club podcast. Listen to us on Spotify, watch us on YouTube, share and subscribe, and follow us on Instagram at New Dentist Study Club.